How's your health, Frank? How you feeling?
Treating patients is a part of David Hatfield's DNA. His father founded Hatfield Medical Group in Arizona more than 40 years ago.
I had a love for primary care from the get-go and wanted to do that after watching him do it.
In the beginning, Hatfield Medical Group operated like most other practices, high volume, fee-for-service, with the goal of seeing as many patients as possible in a day.
We started to realize that physician burnout, retention, the ability to just stay at that pace was not feasible. And thankfully, right about that time is when you started to first hear the rumblings of value-based payment models.
One of the promises of value-based care is it sets out to improve the patient, physician, and practice experience. Here at Hatfield Medical Group, they've adopted strategies that focus on the coordinated care for their patients and improving the quality of care, all while engaging physicians every step of the way.
This is Caitlin, the chronic care coordinator.
First, the practice set up a way to track quality measures. This helped them determine which patients needed which procedures and preventative care. Hatfield Medical Group introduced chronic care coordinators to engage with patients.
What I do as a chronic care coordinator is I reach out to them monthly, make sure they're adhering to their medications, following up with specialists, coming in for their annual well visits, their follow-up appointments, and making sure that they are realizing how important their health is.
It's a benefit because there are times when I would like to ask questions and get answers, but I don't want to have to make an appointment for 3 weeks down the road. And now I've got somebody that I can tell my concerns to.
Frank Mortella, a longtime Hatfield Medical Group patient, also benefited from a newly offered diabetic retinal eye exam. It's a quality measure that is particularly important for people with diabetes.
There's hardly a diabetic patient that leaves this practice without receiving that diabetic retinal eye exam, which has led us to be a 5-star on the HEDIS metric.
We actually had the payers contact us, and specifically Humana reached out and asked how do we move the needle so much and get patients diabetic retinopathy eye screening done, and it was because we implemented this camera. And at the time we weren't getting paid, and once they found out how fast and how quickly we moved the needle on this measure, instantly they cut a check next week.
But perhaps the most important part of the transition was getting buy-in from physicians.
We needed them to understand the why behind all of the different quality metrics that we were going to now hold them to a standard and say, yes, we need to perform mammograms at this level. Yes, we need to be this good at colorectal cancer screening. All the different measures that exist within the HEDIS framework.
All the providers feel like we're working towards that goal of that quality, compassionate care. It's all of us. It's not just the owners, the physicians that lead, but we've all been brought into that. We all feel like we have input.
Physicians spend more time with patients, and the practice has improved access to care. They've been able to do this because their staff works as a team to reach out to patients between visits so physicians can see fewer patients, roughly 1,000 fewer patients per month.
As we've increased access to care in all of our clinics, we've noticed a reduction in ER visits by 10%, which in turn reduces the number of admissions into the hospital. We have found that at Hatfield Medical Group, our patients are most happy when they are being treated by their family practitioner or primary care provider that they're most familiar with, who understands all of their different chronic disease conditions and is able to treat them efficiently in the clinic.
The transition from a high-volume, fee-for-service to a value-based care model is a heavy lift. It needs to be reinforced through a multitude of ways, including practice leadership, trusted partnerships, and measurable data, to name a few. But here at Hatfield Medical Group, they're seeing the payoff, and so are their patients. In Phoenix, Arizona, I'm Stacy Lloyd.